Left to sign up for health insurance on the Affordable Care Act marketplace, a warning to do your homework.
The On-Team's Courtney Garish is here with more on being careful about what you are being sold. Courtney.
Carol, there are a lot of offers out there that sound like the marketplace, but they often come with membership fees and might not meet the government's minimum health insurance requirements. Now, a local organization is getting the word out so consumers don't end up with the wrong product.
It got so confusing.
Adela Strahota retired from her job of 30 years and needed last-minute health insurance for 2015.
Do your homework, but unfortunately I didn't. I knew I had to get insurance right away.
She claims she called the marketplace, but things got confusing. Adela talked to several representatives and says all of them offered different plans. In the end, Adela agreed to the one with the lowest price.
Come to find out, the insurance that they threw at me was catastrophic insurance.
That plan came with a high deductible and premium. Adela was paying more than $300 a month.
I've got the silver 150, and it's good for me.
For this year's coverage, Adela met face-to-face with a local agent to help her maneuver the marketplace.
And I went, oh my gosh, what a difference.
She's now only paying around $62 a month, and her out-of-pocket costs are less.
Good afternoon, Impact 211.
This Wisconsin call center helps people like Adela. It's a central access point for people in need. Impact 211 handles all kinds of calls, including scheduling an appointment for consumers to meet in person with a certified healthcare navigator.
The benefit of the information that we keep is that it's all vetted, so we're making sure that the information that we have is accurate.
Much of that information coming from two organizations, the Milwaukee Enrollment Network and Covering Wisconsin.
Where we're really able to help from point A to point Z and someone getting coverage and appropriate coverage for their family.
Caroline Gomez-Tom is a manager for both programs and many times sees consumers reaching out for help after they've signed up for the wrong insurance.
Those are the plans that aren't considered what you need for the Affordable Care Act.
Plans people purchased outside the marketplace and might not meet the minimum standards of the Affordable Care Act.
You may be insured with this limited or partial coverage, but because it's not seen as full coverage, you may still have to pay the penalty when tax time comes.
There's so much paperwork.
Made less complicated by someone who can help consumers like Adela get the right kind of coverage.
Now I understand it. Now I'm good to go.
And in Adela's case, she actually contacted our Call for Action volunteers before enrolling for this year. They suggested she find a local agent to help her get the best marketplace coverage.
Okay, so Courtney, what are the deadlines for open enrollment in the marketplace?
There are two coming up, and I think people get confused.
Yeah.
December 15th, which is this Thursday, is the last date to enroll for coverage that starts January 1. Another date that's out there is January 31st. It's the last day for special enrollment or to make changes to your plan. So if you need to find a qualified healthcare navigator or get more information on those marketplace deadlines, go to tmj4.com.
Your source for all lighting knowledge.
Yes.